Hey there, Active Austinite. If you found yourself here because you're wondering what you can be doing to prevent your arthritis from progressing, you're in the right spot. Whether you're here because you might have some lumbar arthritis or knee arthritis, maybe some hip arthritis, even arthritis in your neck or your hands, we're going to talk today about 5 things to think about when you are trying to make a plan for your arthritis treatment moving forward, and to talk about whether or not there is a way to prevent your arthritis from getting worse. So, if you're new here, my name is Sarah King. I'm a doctor of physical therapy at Natural Fit Therapy here in Northwest Austin, and we help people 50 plus get moving and stay active and strong through physical therapy, personal training, and other wellness strategies. And we get a question a lot about arthritis because quite a few of our patients come in and they've been diagnosed with arthritis, or they think they might have some arthritis setting in, and they've got a ton of questions. And one of them is, arthritis will just keep progressing, right? There's nothing that I can do about it. Or is there? So today I want to talk to you about what arthritis is and what brings it on in the first place, so that we can talk about 5 things to consider when you're trying to build your arthritis treatment plan. So let's dive in. Okay, before we talk about those 5 things, we need to talk about wear and tear versus inflammation of the joint. Old school thought used to say that arthritis is solely from wear and tear, and that's actually a myth. So there is some component of arthritis, especially in our load-bearing joints like our knees and our hips and our spine, that wear and tear over time can cause arthritis to come on and to continue to get worse. And to some degree, that's true, but that's not the whole story, and we know this now through a lot of research. Things that contribute to wear and tear are how strong are your joints, how much muscle tightness or muscle flexibility do you have in your joints, and also the alignment of your joints. Is something happening to where your alignment in your knee or your hip or your low back is off? Because if that's the case, it's kind of like an axle being a little off on your car. When you drive it for a long time with your axle a little bit off, it can cause a lot of undue wear and tear on your car. Your body is not a car, but the analogy still stands that you want to be thinking about strength, flexibility, and alignment or posture when it comes to avoiding undue wear and tear on your joints. And we're going to talk about how to do that here in a second. The other bucket of arthritis progression and that we need to think about is inflammation. If you have arthritis, you know that sometimes you can pop a ibuprofen or some type of anti-inflammatory and it'll help improve your swelling or your pain in your joints. Well, I want you to think about food the same way that you think about medicine. We swallow pills and we also swallow food, and it's kind of crazy to assume that both things won't have the same impact on your body. So we take medicine to decrease our inflammation. We can also increase or decrease the inflammation in our body by the foods that we eat and the foods that we drink. So we're going to talk about these 2 buckets and approaching arthritis to try and decrease wear and tear on your joints and also decrease inflammation. So there are 5 ways to build a plan around slowing your arthritis progression as much as possible, and we're going to talk about them right now. The first thing you need to consider whenever you are thinking about how to slow down the progression of your arthritis is about strength. So we have a buku of research now that says there is a link between strength around the joint that is arthritic and how much pain or disability you have. We have a lot of research specifically for the knee joint and knee osteoarthritis, but this holds true for any joint where you are getting arthritis, especially in our load-bearing joints like our back, our hips, and our knees. Typically, there's a cycle that happens. When you start to have pain around a joint that happens to be arthritic, what your body does is it says, oh no, I hurt probably because I'm moving too much, so I need to tighten up that joint and not let it move. Typically, that is spasming up our muscles and making them really, really tight and painful, but that helps keep whether our back or our hips or our knees from moving. That spasm happens, and that causes pain. And when we have pain, our muscles kind of get shut off. It's this weird cycle that happens in the body where we have pain and then our muscles spasm up and don't let us move, and that actually causes more pain, and it starts this cycle. And when our muscles spasm up and tighten, they cannot be strong. Tight muscles are weak muscles. So what we see in a lot of research around painful joints is the muscles that are around joints are usually spasmed up and also very weak. This is very true with knee osteoarthritis when it comes to the knee extensors, which we've got another video on how to strengthen specifically for knee OA. But you want to be strengthening your quads. Those typically get weak with knee arthritis. Our muscles around our hips typically get weak with hip arthritis and with lumbar arthritis. And so any type of degenerative disc disease or lumbar arthritis, we're going to be talking a lot about strengthening your core muscles and also your back and hip muscles. So strengthening around a joint can be challenging, especially if you are currently in your spasm pain cycle and you are really weak. So let's move on to number 2, which is food. The second thing that you need to consider when you have arthritis in your body is what are you putting in your mouth? Most of the pain, especially in knee OA or hip OA or back pain, can be much worse when you have high levels of inflammation in your body. Some culprits that can drive up inflammation in your body are gluten for some people, sugar, dairy can sometimes be inflammatory for some people. Everyone's different. Every body is different. Everybody's digestive system is different, but those are common inflammatory foods. And so if you have arthritis, it's important to be aware of the food that you're putting in your mouth and do some self-experimentation. Get rid of some common inflammatory foods and see if your swelling or pain in your arthritic joints goes down at all. So do a little experiment. Sometimes it can take a couple of weeks to really get some of those foods out of your system and to get your system calmed down to start seeing results from that. The third thing to consider is being consistent with your exercise program because it can take 8 to 12 weeks initially to build actual muscle mass in your body when you're doing a consistent program. And the only way that you can actually build strength and tell your body to grow new muscle and to change is to be consistently challenging it in a way where it has to build muscle. So if you are watching this and you are frustrated because you're thinking, I do work out, but it just seems to put me back in the same spot. I'm working out and then I get flared up and then I bottom out again and I stop moving. This is really common, and we're going to talk about kind of that fear of movement in our next bullet point, but that can really knock you off your game and it can cause you to be inconsistent with your program. And there's nothing that's going to set you back more than starting and stopping and starting and stopping. So it's really important to find a program that is low and slow. Steady Eddie wins the race when it comes to building strength around arthritic joints. So I want to tell you to don't lose hope and that it's not just your body and you're not a lost cause. We get a lot of clients that come in our door are in your shoes that have tried it on their own and they're just getting stuck. And typically we see that people didn't start at an appropriate level for their fitness level. They maybe went too hard, too fast, and then they tend to flare themselves up and get knocked off again. This happens a lot. And sometimes people are started low and slow, but they didn't progress themselves because they are afraid of moving, which we're going to talk about right now. So that feeds us into number 4, which is you've got to overcome fear when you have arthritis in any joint, especially knees and hips and back arthritis. So degenerative disc, spinal stenosis, lumbar arthritis. Arthritis can really make you scared of moving. And that actual fear of moving is the more fear you have of moving, the more likely you are to have disability in the long run if you have arthritis. So it's something that myself and all of our colleagues here at Natural Fit are very passionate about, which is educating you that you are not doing any harm in your joints when you move and helping you build a program that is appropriately progressing you over time. We call this graded exposure in the physical therapy world, and it is the thing that trips our clients up the most because what happens when you have arthritis, and maybe you're experiencing this, is you you don't have a lot of knowledge about what it means to have arthritis. And you've been told that arthritis is solely from wear and tear. So why on earth would you keep moving and wear that joint out more so that you're going to have more pain? And I want to stop you right now and say, this is a false way of thinking. So let's back up a little bit and talk about arthritis in general and where the pain comes with arthritis. Typically, with knee pain, hip pain, and low back arthritis, the joints that are arthritic don't have a lot of nerve endings in them. So bone, fortunately, doesn't have a lot of nerve endings in there. So when you have arthritis in a joint, whether you have mild arthritis or bone spurs or whatever it is, that structure in and of itself doesn't have nerve endings or a lot of nerve endings. So most of the pain actually comes from inflammation of that joint. Every one of your joints has a capsule around it, and that capsule can become inflamed, and the ligaments and all the structures, your muscles around your joints are what become inflamed and angry and swell, and that swelling causes more pain on your nerves. Our strategy should not necessarily be, how do I get less arthritis over time? Our strategy should be, how do I lower my pain around my arthritic joint over time? If you can wrap your mind around the fact that moving isn't going to cause your arthritis to get worse, then you can lower your fear of moving and start to move more. And that's actually what we do a lot when we work with clients, because this is very hard to do on your own. And a lot of the research says that you'll be more successful with moving again, getting moving and staying moving if you have someone there when you're trying to do the movements that are painful, whether it's bending down to pick up groceries off of the floor, whether it's getting down on the floor to garden, picking up your dog or your grandkid, shoveling snow. We're in Texas, so that doesn't really happen. But whatever activity you're afraid of, a physical having a second person there to watch you do the movement, to help you problem solve ways to not flare up your pain when you're doing that movement, and then give you a program to help you build strength and flexibility around your arthritic joints so that you can do those movements successfully, is going to be a game changer for you. And a big thing that we coach on here in that category is being able to get on off the floor and to be able to kneel again. Those are two big things that people really struggle with and have a lot of pain and fear around that you can get back to. You just need what we call graded exposure and a coach to kind of help you progress through that. So to sum up number 4, it's really, I want you to think about how much fear you actually have of moving because of your arthritic joint. The more fear you have, the harder it is to get out of that cycle. But it's really important to know that just moving is not going to make your arthritis worse. In fact, movement, especially strength training, is going to help support your joints and lower your pain and disability over time. Okay, number 5. What I see a lot when it comes to clinical practice with people who have arthritis, especially people who have had arthritis for maybe 5, 7, 10 years and are really looking to avoid joint replacement surgery, is a good manual therapy routine. So what is manual therapy? It can be a whole lot of things, but what we see at our clinic most effectively for arthritic joints and controlling pain and inflammation around those joints is soft tissue mobilization, which is targeting really tight, angry muscles with some hands-on mobilization strategies to help relax those muscles and to get them out of that pain spasm cycle, because those spasms can really drive that whole pain problem. So that can be really effective. And all these manual therapy techniques are designed to help get you out of that pain, spasm, pain, avoiding movement, pain, stiffness cycle that we're in. Manual therapy can be a great jumpstart. So another strategy we use sometimes is called dry needling. Some people are a little fearful of this, but it's a little kind of similar to acupuncture needle in different parts of your muscle to help it relax. It's really nice. And then taping. So you may have heard of rock tape, kinesio tape, but it's a type of tape that can, in different configurations, we put tape on your your knee or your hip or your back or your core to help facilitate muscles to activate or to help muscles relax or just to support the joint as a whole without being as intrusive as a brace. So manual therapy is the fifth thing that I always recommend to include in a program when you're trying to control pain and inflammation around an arthritic joint, because it can really jumpstart you and decrease your pain enough for you to move more so you can get stronger, so you can move more and get stronger and have less pain and have less disability and get back to doing the things that you love to do, like hiking and biking. And we have a great testimonial on our site by a woman whose name is Anel. She came in with knee arthritis, hip arthritis, back pain, and she wanted to get back to hiking and biking, and she did, and it's a wonderful story, so definitely check her testimonial out. But in summary, don't lose hope. If you are coming across the fact that you've got arthritis in your knees, your hips, your low back, your shoulders, your neck, anywhere, just know that these 5 things can really help you improve your overall prognosis with arthritis down the line, help you avoid unnecessary injections, pain pills, and surgery, which is what we're all about here at Natural Fit. So if you do need some help and guidance and you're in the Austin area, to get started on some type of fitness program that helps you build your strength in a way that doesn't flare up your pain, helps you gradually progress over time, we would be happy to get you started. We often see people who come in for knee pain, hip pain, and back pain from arthritis, shoulder pain, neck pain. And we help them decrease their fear of movement by helping them understand how to move more effectively without flaring up their pain, and then give them the start of a program that they can use and go off and use to get stronger and more mobile over time. So we would love to help you. You can check out the link below this video to get started on that. But I hope that you are encouraged by this video. Let me know what you thought in the comments below. And if you have any questions, you can pop them there too. So I hope you're having a great day. Stay moving. Smile, and I will see you in our next video.